Joining me now is Dr. Anthony Harris. He is a Chief Innovation Officer and Associate Medical Director at WorkCare. Dr. Harris, thank you so much for joining me today.
Thank you. Pleasure to be here.
Now, as the United States and the world continues to navigate itself through the coronavirus pandemic, something that's being
Mhm.
talked about more and more are these potential short term and long term side effects for people who have actually recovered from the coronavirus.
Mhm.
Worldwide, about 49 million people have recovered. But with that being said, can you talk about, some of these potential side effects that these people could face?
Sure. So we know the side effects are numerous, and they mostly are associated with the effects of the virus that it has on blood vessels in the body. For example, we know that it can cause coagulopathies, meaning that the blood tends to clot in places that it normally would not. And that can lead to a number of things: increased risk for heart attack, increased risk for stroke. It can even lead to erectile dysfunction in men. We know these side effects are happening at unfortunately higher rates than what we would normally see without COVID being around. And so obviously the most impactful outcome of COVID death is still associated with the cascade of events that the immune system undergoes when it encounters COVID-19. So in terms of other long-term effects, the mental health effects are actually pretty profound as well, associated from some of the blood vessel, what likely may be some of the blood vessel effects in the brain. People talk about a fogginess, a COVID brain, if you would, and we've seen that firsthand in helping patients. And then long-term kind of the stress effects of COVID and dealing with this pandemic. So unfortunately, we'll be dealing with these side effects long after we have people immune, either from recovery and or vaccination.
Whether or not it's herd immunity, whether it's people that are being vaccinated. In your own professional opinion, what do you think the end game is for COVID? Do you think it's going to be, something that's cured, or do you think it's something that, will be similar to the
Mhm.
flu, where everyone or most of, the population gets a vaccine and sort of just goes
Mhm.
on with their daily life?
Sure. So evidence is suggesting that this could be a cyclic event for us in dealing with COVID and a seasonality similar to the flu, as you mentioned. And what that looks like, unfortunately, would be kind of a layering on to the flu season as it has been thus far, and a need to vaccinate individuals on an annual basis. The immunity that we see from either recovering from COVID, natural immunity, or what's called acquired immunity from vaccination, we still don't know the length of time, the full length of time that immunity will be imparted to most people. It could be within that 90-day period, is what we've seen. It could be longer, 6 months to 8 months. We do know some of the immune cells to COVID-19, once you recover, hang out for about 8 months in your system. But again, that full cycle of protection, 12 months or multiple years, we just don't know. And so the hypothesis is out there that this could be cyclic. And we're dealing with COVID, as Tony Fauci has said previously, for at least the next 5 years. And the pharmaceuticals, I believe, are prepared for that cyclic round of updating the vaccine, just like we do with the flu.
Now, 5 years obviously seems like a very long time, especially if these lockdown measures continue, if people aren't
Mhm.
able to go to school, go to work. Um, what will that 5 years look like in your best guess? Will that be this continuation of lockdowns, or will people start to be able to go to work and be able to go back to school?
Sure. So back to the word you mentioned just previously, herd immunity. That's what it comes down to in terms of protecting most people from COVID-19. And so in the US in particular, herd immunity can range in terms of percentage of people that need to have immunity to COVID-19 from 4% all the way up to, excuse me, I said 4%, I meant 40%, all the way up to 80%, depending on the what's called the reproductive rate of COVID, which right now kind of sits nationally around 1.2 to 1.5, meaning 1.2 or 1.5 people are affected by, on average, one person or one case of COVID-19. And so when we look at demographics or locations, geographics like New York and Florida, LA County that have been hit hard by COVID, that our not number is as high as 5 in some studies. And that means 80% of the population would need to be vaccinated. If we cut it down the middle of the road, we're estimating 60% of the US needs to have immunity. That's 196 million individuals for us to get out of this strong social distancing scenario that we're in and have been in for some time. And unfortunately, getting to that number is not going to be at earliest until the end of this year. And by some measures, if we continue the vaccination logistics as we have been so far, that could be even until 2021 that we see and reach that magic number of 196 million individuals.
Now, obviously, the vaccine is being distributed, and I
Mhm.
believe it is just about 5 million people have gotten the vaccine before, have gotten the vaccine so far, at least one dose of it. In
Mhm.
your opinion, I mean, obviously a lot of people are taking the vaccine, but also some people are hesitant to do that. So, what do you say to the people who are a little bit on the more cautious side with taking the vaccine and don't want to do it right away?
Sure. So I first would say, the vaccines are safe, right? We have data on both Pfizer, Moderna, AstraZeneca, and the other vaccines that are coming online, hopefully approved by FDA soon. And so the safety profile is profound in regards to those mRNA vaccines, Moderna and Pfizer, as well as AstraZeneca, which is more of a traditional manufacturing process for that vaccine. The second thing I would say is when we compare then the potential side effects from the vaccine versus what we know to be true in terms of effects of contracting COVID-19, it's far worse to get the virus and have to go through it, recover, and hopefully, recover and not be amongst the mortalities. And that is the impetus for really pushing, let's get out there and get that vaccine. We want to all be safe. We want to all go back to normal as soon as possible. And the only way to really get there is to get to that herd immunity number. And that's going to require vaccinations across the board.
The
Mhm.
Biden administration will be in charge of, distributing the vaccine. So can you talk a little bit about sort of logistically what that will entail and any potential challenges that they might face?
Sure. There are some tremendous challenges from a logistics standpoint, depending on which vaccine is what we're talking about, right? And the Pfizer vaccine we know has to be at very low temperatures, -70 degrees. If we talk about Moderna, that's -4 degrees, basically refrigeration temperatures. AstraZeneca being the most opportune from a logistics standpoint to have broad distribution requires only refrigeration as a traditional vaccine. And that first logistic has been an issue for distributing vaccines. We know, like you mentioned, 5 million people roughly vaccinated. We have 3 times that number in terms of distributed vaccine to different states. And so if we look at the challenges, we look where the bottlenecks are, it is a state by state a logistic problem where, federal government pushes it out, gives it to the states, and now we have a determination of how we allocate. Does the state follow the CDC recommendations in terms of prioritization? And then finally, when the rubber meets the road, do we have the infrastructure with the hospitals and clinics to handle this broad vaccination that needs to happen to get us to herd immunity? So far, unfortunately, the answer is probably not. And that's why estimates are looking at vaccination levels not reaching that herd immunity until well after this year.
Well, I hope we can reach it sooner rather than later, so we
Agreed.
can return to some sort of normalcy. Dr. Harris, thank you so much for joining me today, and I hope you'll join me again soon in the future.
Would love to. Thank you and take care. God bless.